We talk about the brain and the mind all the time, almost like they're two totally separate things. But what if that whole idea is wrong? What if the line we've drawn between them isn't just blurry? What if it isn't really there at all?
So let's think about it like this. When something feels off, is it a problem with the brain's actual hardware? The physical wiring? Or is it more of a glitch in the software? In our thoughts, our feelings, our very consciousness? That's the big question we're going to dig into.
For a long time, even in medicine, we've kind of put the brain and the mind in two separate boxes. So in this first part, we're going to explore why that's really a false divide. We'll look at the body's command center, and then we'll look at our inner emotional world.
Okay, so here's the hardware. This is the nervous system. It's this incredibly complex electrical grid running through our entire body, with the brain and spinal cord as the main hub. This physical structure, it controls literally everything, from your heartbeat to you moving your hand. And then, on the other side, we have what we think of as the software, or mental health. It's not just about not being sick. It's our whole state of well-being. It's how we think, how we feel, how we deal with the world around us. It's the experience that's running on all that hardware. So, hardware, software. Seems simple enough, right? Well, here's where it gets absolutely fascinating. What happens when the hardware gets damaged, but the very first sign that something's wrong shows up in the software? This right here, this is the key. A physical problem in your body might not show up as a fever or a pain in your arm. Nope. Instead, it can show up as sudden confusion, deep depression, or crippling anxiety. It's a medical issue, just wearing a really convincing mental disguise. And look, this isn't just a wild idea. This table is pulled straight from medical texts, and it lays it all out in black and white. Just look at this list. Infections, strokes, brain tumors, head injuries, even some medications, all listed as direct, physical causes for what we'd call severe mental symptoms like delirium or dementia. The connection is right there. It's undeniable. Let's just take meningitis as a perfect, concrete example. It's an infection that causes swelling around the brain and spinal cord. It's a clear hardware problem, right? But as we just saw, it's also a known cause of delirium and dementia, classic software failures. This is the exact spot where Chapter 15 on nervous system disorders crashes right into Chapter 21 on mental health. Okay, so if a physical problem can look exactly like a mental one, how on earth is anyone supposed to tell the difference? Well, that is the million-dollar question, because the symptoms can overlap in some really, really confusing ways. I mean, on one hand, you have symptoms that just scream neurological problem. Things like a stiff neck, paralysis, or seizure. And on the other hand, you have signs that point directly to a mental health disorder, like delusions or hallucinations. They seem like they're from two completely different planets. But then you get into this gray area, this overlap zone. What about a headache? Or feeling weak? Or having sudden mood swings? Are those physical or mental? The answer is they could be either. They're listed as common symptoms for both nervous system problems and mental health conditions. And that's why digging deeper is so incredibly important. So because of this tricky overlap, clinicians can't just take a guess. They have to become detectives. They need to follow the clues and use a really methodical process to figure out what's truly going on with a patient. And this detective work isn't random. It follows a clear path. First, you've got to listen to the patient's story, get the whole timeline. Then comes the hands-on physical and neurological exam to check all the body's wiring. And finally, if there are still questions, they use technology to literally look inside. And this is how they do it. With amazing tools like CT scans, MRIs, and EEGs, these machines let doctors see the brain's actual structure, its soft tissue, and even measure its electrical currents. They can spot the tumor, see the inflammation, or find the damage from a stroke. They find the physical culprit hiding behind the mental symptoms. All right, so we've gone through all of this. What's the bottom line? Let's boil it all down to a few must-know clinical pearls, the key takeaways that really give us a much smarter, more holistic view of health. First, and this is probably the most important one, a problem with the body can show up with only mental symptoms. The big takeaway here is that we can't just assume that a big change in someone's mood or behavior is always just in their head. And this is a huge deal, especially when talking about older adults. This quote from the source material is so powerful. It's a warning, really. It's way too easy to just write off an older person's confusion as, oh, that's just dementia, when it could actually be a treatable neurologic condition. And that leads us right to our second big takeaway, which is basically a clinical rule of thumb. If a person, anyone, has a sudden dramatic change in their personality or their mental state, you have to consider a physical cause. You've got to rule it out. It's just fundamental to good care.
And that brings us to the final, most important conclusion of all. We started this whole conversation with that analogy, hardware versus software. But everything we've looked at shows us that's just the wrong way to see it. The brain and the mind aren't two separate things fighting for control. They are one deeply connected system. They're two sides of the very same coin.
So I'll just leave you with this question to think about. If the physical body and the mental experience are so deeply intertwined, if they really are just two sides of the same coin, then how should we redefine what it actually means to be healthy? And how can we start treating the whole person in a way that truly honors that profound connection?